And welcome back. Well, if you sleep with someone who snores, then you know it can be annoying as a problem. And in some cases, it can also be a sign of something serious.
So today, various treatments if snoring is keeping you or your partner up at night. Dr. Hilel Swerdlin is with Sinus and Snoring MD, and his team identifies the causes of sleep and snoring problems and helps patients find relief too. Great to see you again.
Great to see
Hi,
you.
Doctor.
Thank you.
Thanks for being here. Let's talk about what causes snoring, because I know a lot of people have heard of sleep apnea too, but they're not always sure what causes snoring and sleep apnea.
Well, snoring is caused by a narrowing or partial blockage of the upper airway. The upper airway starts in the nose, and it includes the right and left nostril. The airway goes back in the nose and dives down into the throat, goes behind the throat, behind the soft palate, behind the tongue, and then it gets into the airway. So if there's any blockage in any of those areas, you have turbulent airflow, and that causes vibration. What I like to tell my patients, imagine that your upper airway is a garden hose, and there's water coming out. The moment that you squeeze it, the water starts coming out with a tremendous amount of pressure, and that causes vibration.
Right, so that's causing the snoring. Does that change throughout life? Because I always wonder, like, if you have an anatomical problem like that, is it like that since you were a kid, or can that change?
It can change over life. For example, if you gain weight, the throat becomes much smaller. You get like a little belly inside of your throat. We also see patients that are very athletic, that are very strong, so they're growing muscles inside of the throat, where you don't want to have muscles or a belly. You want to have an
I didn't know that.
Yeah.
Then you can develop sinus infections, polyps, nasal polyps, allergies that can also cause snoring.
What can people do to take care of it at home?
That's an excellent question. There's a lot of remedies out there. Some of them are actually effective, if you can, and they address the upper airway. For example, they have devices to open up the nose that you can use. You have sprays to try to open up the nose. Some of those can actually be addictive, so they can be problematic. And then one of the main issues with snoring is that the tongue falls back into the throat, so they have devices to prevent the tongue from falling back, mouthpieces, kind of like the ones that athletes use. They have also chin straps, and they have pillows to prevent you to sleep on your back, and they have different beds. Not everything works, but
It's worth trying.
Different options at least.
Another important one is losing weight. Weight is probably one of the main causes of snoring and sleep apnea, so that's another one.
Absolutely. If a patient wants to come in to be evaluated, what do they expect when they come to your office for that evaluation?
Yes.
What happens?
When they come in, we like to make them feel at home, so we have a nice conversation, informal conversation, and then we do a very thorough evaluation of the upper airway, which is painless. People are worried that it's going to be painful, but we use a tiny little spaghetti camera, and we're able to look in the nose and in all the airway. We actually make a high-definition video to share with our patients. If we need to, we can do imaging studies. We can also do a home sleep test if we're concerned that the patient might have obstructive sleep apnea, which is when you actually stop breathing in the middle of the night. And we have 3 different types of sleep tests that we can use. One of them is actually evaluates snoring very well and sleep apnea, because it allows you to sleep in every single position. It's a little watch. So some patients, all they need is to not sleep on their back. So we have all that evaluation.
So once you evaluate it, diagnose it, then what treatments do you have available for snoring as well as sleep apnea?
So once again, we address the upper airway. An easy thing to do is to open up the nose. It's a simple office procedure to ensure that they can breathe better. There's a brand new FDA procedure, which is like the facelift of the throat. It's called the levoplasty, and we use implants to stiffen the throat, and then they have little sutures that bring up the throat. We also have procedures to give a little shave of the soft palate. If the tonsils are very enlarged, we can actually shrink them, giving like a little liposuction to the tonsils. And we also have the ability to prescribe a CPAP if it's necessary, or mouthpieces.
Okay, so somebody's just got fat tonsils. Got a
liposuction of the tonsils. That's right.
That's cool. So a lot of these, like some of these procedures you're talking, are they just in-office procedures?
A lot of them can be done in the office.
Wow.
We would have a significant amount of anesthesia options, so we can do it in the office. Sometimes it's just a spray, sometimes it's a gel, sometimes
so you might be awake.
Yeah, sometimes it's the laughing gas, which makes you really relaxed, which is it's a favorite of patients. We can give you mild sedation, twilight, or if we need to take you to an operating room, we have a nearby surgical center operating room where we can go. But we can do the majority in the office.
I know last time you were here and joined us on the show, you offered free screenings for nasal, sinus problems, snoring. How did that go for you?
It went great. What we learned is that a lot of patients are out there on the fence. They don't want to see anybody, or they're afraid, and it was so successful, and we were able to help so many patients that we want to extend this again, and this time for patients that have problems with their nose, with their sinuses, or they have snoring, or they might have sleep apnea, we're extending for a limited time the free screenings.
That's great.
Nice.
So free screening when they come in and meet with you if they mention the morning blend.
Yes.
That's pretty incredible. So here's how you can do that. Take advantage right now with Sinus and Snoring MD, the free screening for nasal, sinus, and snoring. If all you have to do is call 262-652-2887 or sinusandsnoringmd.com, but make sure that you call right away to get that free screening because there will be a limited amount, but it's really nice that you're extending that.
Thank you.
Thank you so much, Doctor.
Great
Thank
seeing
you,
you.
doctor.
Thank you so
Great
much.
seeing you too.